Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about how to check for mold in sippy cups. Recently, parents have found mold growing in their children's sippy cups. The mold grew in hard-to-clean places despite washing these cups in hot water and in dishwashers. If you think your child might be exposed to mold in her sippy cup, you can check it for mold and keep your child safe. Watch till the end because I will be talking about checking a sippy cup for mold, assessing the use of your sippy cup, understanding how mold affects children. How old should my baby be before using a straw sippy cup? Are straw sippy cups clean and hygienic? Are straw sippy cups better for my toddler's teeth? Checking a sippy cup for mold. Take everything apart. To check your child's cup for mold, take it apart. This includes removing all pieces. Some of the pieces, especially the spouts, may be difficult to pull apart, but make sure you separate all parts. Many of the sippy cup spouts will easily pull apart. Others may have special tabs or levers on the side of the spout that will pop them apart. Other sippy cup spouts may need to be forced apart. For example, some need something like a butter knife to help pull the two parts of the spout apart. Break open anti-leak parts. Another way to check for mold is to break apart the anti-leak pieces of the cups. Many parents have found mold growing inside these pieces. Although you can detach the pieces and clean the outside, the inside is hard to get to in some sippy cups. You may need to take a hammer or other tool to the piece to get it to pop open or break apart. It depends on your type of sippy cup. For example, the Tommy Tippy sippy cups have an anti-leak spout which most parents had to break open to check for mold. The sippy cup will be unable to be used after breaking these parts of the cup. Consider clear valves. This allows for parents to be able to see any mold buildup in the hard-to-clean anti-leakage spout. When you buy a sippy cup, you can look for a sippy cup with clear parts. This will allow you to be able to see any mold that starts growing. Assessing the use of your sippy cup. Determine if you have put the right liquids in the cup. According to the manufacturers of the sippy cup, mold can occur if the wrong kind of liquids are put in the cup. However, using correct liquids in the cup shouldn't lead to mold. Recommended liquids include cold, thinner drinks, like water, milk, and juice without pulp. Liquids that shouldn't be used in the sippy cups include formula milk that is thick, carbonated beverages, juice with a lot of pulp, and liquids that are hot. Decide if you have left liquid in your cup. Manufacturers of sippy cups claim that liquids should not be left in the sippy cups for long periods of time. If liquids are left in the cup, even if they are cleaned later, mold may form. Think about how often you have cleaned your child's sippy cup. Do you clean it right after she uses it? Do you leave liquids inside it for a long time? If you think you have left liquid in the cup for long periods of time, consider tossing the cup and buying a new one. They are hard to clean after liquids have been left in them for a long time. Review your cleaning practices. Mold may occur in cups that have not been properly washed. It is recommended to thoroughly clean sippy cups after each use to prevent mold from building up. It is also recommended to take all sippy cups parts apart before each cleaning. Most cups can be washed in the dishwasher. You can also soak them in hot water. Consider washing them by hand with a brush to get inside hard-to-reach places. When you wash your cup, make sure you take it apart fully. Follow the manufacturer's recommended cleaning instructions. If your sippy cup does not come with one, go to the company's website for videos on how to clean the cups. Switch to a different type of cup. Proper washing and use may help you prevent mold in a sippy cup. However, if you are concerned about mold in your child's cup, you can buy new sippy cups every month or two. You can also switch to different types of cups that are less likely to mold. You can buy disposable sippy cups. These cups have fewer parts, so they are easier to clean. Plus, they are cheap, around $3 for a pack of 6. If your child is old enough, switch your child to a straw. Straws may be better for your child since sippy cups have been linked to lips and speech impediments. Understanding how mold affects children. Look for sinus problems. One major symptom of mold exposure is nasal problems. This includes a stuffy or runny nose. Your child may also have a nosebleed due to this sinus irritation. Some people won't be affected by mold. However, other people have allergies to molds and will develop symptoms due to exposure. If you think your child may have mold in her sippy cup, switch it with a new one and monitor her for sickness. Check for respiratory problems. The most common problem associated with mold exposure is upper respiratory tract problems. Mold may cause difficulty breathing or asthma, or worse, asthma if your child already has it. Another symptom could be tightness in the chest. Your child may develop a cough or start wheezing. Monitor for other symptoms. Mold exposure may cause a few other allergies or irritations in the face and head. Mold exposure can cause a sore throat and a headache. Mold may cause topical irritation, like a skin or an eye irritation. Know that ingesting mold is not serious. While you don't want your child drinking out of a moldy cup, you shouldn't panic if you find mold in your child's sippy cup. If your child is allergic to mold, she may develop some mild, unpleasant symptoms. Limited exposure, however, shouldn't cause any major illnesses. If your child develops symptoms connected to a moldy sippy cup, replace the cup and monitor your child's symptoms. They should go away shortly after removing the source of the mold. Take your child to the doctor. If your child has symptoms related to mold, or you are worried about her well-being after discovering mold, you can take her to the doctor. You may consider waiting a few days after changing her cup before taking her to the doctor so you don't waste a visit. A checkup by the doctor can ensure that your child is fine and that she did not get any secondary bacterial infections from the sippy cup. How old should my baby be before using a straw sippy cup? The American Academy of Pediatrics recommends transitioning out of bottles between 12 months and 24 months of age. Although, because infants can begin drinking water as young as 6 months, they can also start using a sippy cup that young. This helps expose your baby to different drinking vessels at an early age, and can make the transition to an open cup easier in the long run for parents and caregivers. Learning to use a straw sippy cup can help strengthen cheek, tongue, and lip muscles to help further advance speech and feeding skills. Are straw sippy cups clean and hygienic? Straw sippy cups often come with multiple pieces, like a valve, straw, or even weighted piece. With so many pieces to wash, straw sippy cups can easily become a breeding ground for bacteria and mold. They are sanitary to use for infants, but only with the proper care and cleaning. To keep your baby's straw sippy cup sanitary, always rinse immediately after use to prevent mold from setting in. If you can't rinse, allow the cup and its pieces to soak in soapy, hot water before cleaning them with a straw brush. Once you've finished cleaning them by hand, place them in the dishwasher to be sterilized, which can help kill any bacteria left behind. Are straw sippy cups better for my toddler's teeth? Sippy cups are useful when transitioning to an open cup, thanks to the similar sucking motion babies use with a bottle. However, using sippy cups for an extended period of time can lead to developmental problems, like tooth decay or speech problems. Despite their convenience, straw sippy cups are often used for too long and sometimes with liquids high in sugars, like juice or soda. These sugars can stay on your child's teeth, leading to plaque and other dental issues, such as cavities. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.